Where dentists are scarce, American Indians forge a path to better care. L.A. Conner, Washington. Going to the dentist evokes a special anxiety for Vern McLeod. He grew up on the Swinomish Indian Reservation here in northwest Washington state in the 1950s and vividly remembers the dentist who visited periodically. The doctor worked from a trailer, and did not bother with painkillers. They just strapped us down and drilled, said Mr. McLeod, 70. Poor oral health has plagued tribal lands across the nation. Indian preschool-aged children had 4 times the rate of untreated tooth decay as white children in a recent study. Poverty, diet and a decades-long lack of access to good care on remote reservations compound the problem. But Indians and health experts now see hope. If formally trained dentists are scarce, they ask, can people who master many of a dentist's skills but lack the professional degree get the job done just as well? Daniel B. Kennedy is out to prove that they can. Mr. Kennedy, 56, a soft-spoken Tlingit native Alaskan, is a dental therapist, the rough equivalent of a physician assistant. He is trained to perform the most common procedures that dentists do, from fillings to extractions. Since January, when he started at the Swinomish Dental Clinic, over 50 miles north of Seattle, he has been the only dental therapist on tribal land anywhere in the lower 48 states. He studied in Alaska, which has the nation's only program patterned after one in New Zealand aimed at training therapists specifically to work in underserved tribal areas. Laws here in Washington and most other states bar dental therapists, who have long been opposed by the American Dental Association, so the tribe created its own licensing system. The Federal Indian Health Service, which pays for medical care on Indian lands, cannot compensate therapists unless authorized by the state, so the Swinomish, pronounced Swinomish, needed private foundation support and meticulous accounting so that no law was violated. We had to take matters into our own hands, said Brian Kledusby, the chairman of the Swinomish Senate and president of the National Congress of American Indians. The breaking point came in 2015, after Washington's legislature, pressured by the dental lobby, Mr. Kledusby said, declined for the 5th year in a row to pass a bill allowing a therapist program. Asserting tribal sovereignty, the tribe forged ahead anyway. The American Dental Association is no friend to American Indian tribes, Mr. Kledusby said in an interview. A spokeswoman for the American Dental Association, Dr. Jane S. Grover, said her group supports tribal self-determination, but that therapists, whatever the intentions behind their training or hiring, remain a bad idea. Drilling on a tooth is a surgical procedure, said Dr. Grover, who is the director of the association's Council on Access, Prevention, and Interprofessional Relations. And surgical procedures, she added, should be performed by a dentist. She said that poor oral health, wherever it occurs, is a societal problem that can include elements of poverty, diet and lifestyle choice, not just access to care. But the ADA, Dr. Grover added, also has no plans to challenge the legality of the Swinomish project.